monthly, and then past that it's usually every 6 months or as needed maintenance on the machines. As far as daily, usually the things that we do are going to be just running a blank, and blank measurements help make sure that the quality control measurements on everything are up to date, that there's no cleaning or quality control things that need to be done. This booklet stays on top so that anytime a blank is run, we always check to make sure that those blank measurements are within a specific set of guidelines. If anything is off of those guidelines, high or low, we need to, before running any actual testing for a patient, we need to figure out why. And then we would use our guide to troubleshoot and figure that out. For weekly maintenance, it's going to be cleaning the exterior of our CVC machine. We use a green, kind of like simple clean, simple green type cleaner, nothing harsh like a bleach chemical cleaner or anything like that. We just spray it onto a lint-free cloth, wipe down the entire outside of the machine, making sure that any filters, any fans on the machine are kept free of lint and dust. Of course, pet hair is an issue here. Our keyboard, we make sure that we spray down with some canned air to get all those particles out of the keyboard. And then we also clean the wash head once a week to get all that extra salt buildup off of there. Monthly, we also do a prime all cycle, and we run a cleaning cycle on the analyzer just to make sure that we're keeping up to date and making sure that all of our lice lines and all of our lines here are primed, and that our reagent pack has enough chemical in it for all of the testing we need. And then every 100 tests or so, or as it asks us to, so it could be every 3 months, it could be every 6 months, it could be every month, we're going to do an enzymatic cleaner, which is a little cleaning product that we have. We put about 0.3 mLs into an EDTA tube, and we run an enzymatic cleaning cycle on our CVC machine. And again, that's as it asks us to, but it's about every 100 tests that we run, it's going to ask us to do that. And then about every 6 months, we're going to run we're going to do what's called a reagent pack change, which is this big thing over here, or as we get low on it. So if you run more tests, it's going to require you to clean it more or change it more frequently. We don't tend to run enough that we need to change it more than the 6-month expiration date, but it will make you change it every 6 months if you run the test less frequently, that you don't run out of the reagent pack by the 6-month date. When you do that, you do need to do all of those things. So you need to do the enzymatic cleaning, you need to do the prime cycle, you also need to do a new quality control change, so you need to get a new blood sample to do a quality control check on, and then you also do a bleach cleaning, so it's kind of resetting the entire system. So that is CVC maintenance. So today I'm going to show you how to run an ELISA snap test. We're going to use a 4DX test on a dog today that we ran, or that we pulled the blood on. So what we're going to do is we're either going to use a anticoagulated lavender top tube, or we're going to use a spun down serum separator tube. We're going to use the lavender tube today. We have our snap test, which comes in a complete kit, and that also includes the conjugate, which is the blue liquid here. So we need 4 drops of the blue liquid, and that's going to go in a single-use tube here, and it's going to be 4 drops. And then I'm going to open my test kit, and there's going to be a pipette in here. And I'm going to use that to get out my sample. And I'm going to use 3 drops of my blood sample. And that's after I've mixed my blood sample, after inverting it 3 to 5 times. And I've got 3 drops of sample in here. So I'm just going to mix everything together, just 3 to 5 times, just making sure that my conjugate and my blood sample have mixed together. So I'm going to put my sample into the well here, making sure I get as much of that in there as possible without wasting any of it. Now I'm going to wait for the blood sample mixture to get drawn up into my little sample well on the other end. It can take up to 60 seconds, and at that point is when I'm going to snap the test down. I don't know if you can see that at all. If you can, it's just starting to enter, so I'm going to go ahead and snap down. And at that point is when I'm going to start my 8-minute timer. So it is now 12:29, almost 12:30. So 12:38 is when I'm going to read my test results. So I'll see you back in 8 minutes. Okay, so our 8 minutes is up, and we have some results for the dog. So our test actually came back with 2 positive results, so I'm going to show you. So if we can zoom in on the test. So this upper left-hand corner is going to be our control dot. We always want to see a control dot come up on the test. That means that our test ran properly and that we have a successful test. If you don't see this dot, then the test is inconclusive and it's not a good test and you can't rely on the results. The other 2 dots that you see forming here are actually positive results for different diseases. So the bottom dot here in this little circle is positive for Lyme disease, and then the one higher up in the middle there is going to be positive for anaplasmosis. I'm going to start by taking my anticoagulated blood, and I'm going to add that to my 2% formalin, which I have here in my clear tube. I have 10 mLs of my 2% formalin solution. So I'm just going to invert my blood real fast, and I'm going to take 1 ml of my blood. I'm actually going to take a larger syringe. So I'm just going to carefully add this. Now I'm going to invert after the top is on to mix my sample. Once it's inverted, I'm going to put this in my centrifuge. I'm going to fill up a balance. And I'm going to centrifuge this for 5 minutes. Okay, so we're done spinning down. So I'm going to discard all except for the plug. I'm going to place it back into another formalin container. And then I'll discard all of this safely per protocol at the end of the testing. Okay. Alright, so now I'm going to add a drop of new methylene blue to the bottom of the vial. I'm going to mix with a pipette by sucking up and down. I'm going to take a slide and a cover slip. I'm going to add a drop to the center of my slide with a cover slip. And I'm going to look at this under 10x power and look for microfilaria. Alright, so I have not seen any sign of heartworm on the slide, no microfilaria. So we're going to call this negative. And that is how you do a modified knots test. So we're going to start by taking some of our fecalizer solution, which is already a little bit in here, and we're going to mix at least 2 grams or so of our fecal sample into our cup here. We're just going to mix it up really nicely. Try to break up all of the clumps that we can. And then once that's done, we're going to take our gauze and we're going to drape it over the container that we're going to put the flotation in, and we're going to pour it in, and we're going to strain out the large pieces. All right, we're going to grab this. This is going to come out. This is all garbage. Okay. Put that in the garbage. Okay, the next step is going to be to form a meniscus on top of the container where we're going to run the float. I have here. And then I'm going to take my cover slip. I'm going to place it just on the top. There we go. I'm going to let this sit for 10 to 15 minutes. So now that it's been 15 minutes, we can take our fecal float and we can go ahead and read it out. So what that requires is we're going to take a microscope slide and we're going to remove our cover slip off of our container. So we're just going to lift straight up off of the top of our container. And we're going to place it right on top. And then we're just going to read it under the microscope. Usually for egg identification, you're going to start at a 10x power. Sometimes for the protozoans, you need a 40x, but you don't ever look under a oral immersion lens for parasite screening for fecals. So now I'm going to show you how to do a fecal direct smear. So what that requires is either a little bit of saline or a little bit of fecal sol solution and an equal amount of the stool. So we're going to put a couple drops of the solution on the slide, and I'm going to take a wooden applicator and I'm going to take an equal amount of the stool. And I'm going to smear that. We're going to mix that on the slide. We're going to keep mixing it until it starts to make an even mixture. We want to be able to read through this. So you don't want it to be so thick that you can't read through it. If it is, then it's too thick. You're not going to be able to get a good read on your slide. And I think I actually need a little bit more of my fecal sol. I think think I made it a little too thick. There we go. Okay. But you want it to be almost like you can't tell that there's two different substances on here. You want it to be a completely one mixture. Okay. Once that's done, you're going to remove any of the large pieces of your feces. So if there's any thick pieces that you can't break up, if there's any like chunks, hard pieces, pieces of debris, grasses, anything like that, you're going to remove those, which I have on the end of my stick here. And then you're going to apply a cover slip to the smear, and then you're going to examine that under your microscope. Okay? Is fecal float by a centrifuge. So it starts off very similar to a fecal float because it is a fecal float. We're going to start by taking more of our fecal sol solution in a cup, and we are going to take our stool sample, and we're going to mix another 2 grams or so of that fecal sample in. So now we're going to fill the rest of the way up with fecal sol. So we want to leave a little space because we don't have a fecal centrifuge here. So we want to leave a little bit of space so that we can centrifuge this. So I'm going to fill, this is a 10 ml, so I'm vial here. So I'm going to fill it up and leave a little bit of space at the top. And I'm going to close it, and then I'm going to fill it, not a balance with water though, I don't need to fill it up with fecal sol, to the same mark, so that it's got a balance that is loaded the same weight. Alright, so we're going to centrifuge this. And this is our sample. Okay. So we're going to fill the tube the rest of the way until a meniscus forms on the top. And then we're going to place the cover slip. And then we're going to wait the same 10 or 15 minutes, just like before. And then we'll read the sample under the microscope, just as with the regular float. Okay. So our fecal float with centrifuge has been sitting for about 10 to 15 minutes now. So we're about to put it on a slide. So just like the regular fecal float, we're going to remove the cover slip straight up and put it right on top of a slide, and then it will be ready for us to read from underneath of a microscope. So we're just going to lift it straight up, and it's going to go right on top of our slide. Now I'm going to do a sedimentation for a fecal sample. So what we're going to do is we have a sample of fecal in here, and we're going to add some tap water into our cup instead of the fecal sol, and we're going to mix this in here. What I'm going to do is, instead of straining it directly into my tube, is I'm going to strain it into a cup first, and then I'm going to pour that into my tube. So I'm going to centrifuge with a balance at the other side. When that's done, I'm going to pour off the liquid, and then I will continue at the other side. So now that our centrifuge has stopped spinning, we're going to remove our sample carefully, and we are going to pour off the liquid and carefully not disturb the pellet at the bottom. Okay. Now what we're going to do is we're going to take a little bit of this top layer. I'm going to get a slide out. We're going to take a little bit of this top layer of the pellet and we're going to put it on the slide. This is usually used for animals large animals whose eggs are too heavy to be seen on normal parasite screening. So large animals, so we don't usually use this in small animal practice, but it's good to know if you work on a farm or if you have large animals. So this is Susie Q, and we're gonna get some ear smears from her today. We're gonna take our cotton tip applicator. We're gonna start with the left side. I'm just gonna get a little bit of the discharge. Left side first. I'm going to take the left side and I'm going to put that on the left side of my slide, and I'm going to roll it and not smear it on the slide. And I'm going to do the same thing on the right side. Are you okay holding on that side? Okay. There. Okay. Rolling that on the right side of the slide. This is one of the only times you're going to actually heat fix the slides, and this is because you want to break down some of the wax before we stain them. So I'm going to go stain the slide, and I will pick back the video at that point, okay? So now I'm going to stain our ear slide that we made. The first thing that we're going to do is we're going to heat fix the slide a little bit to help break up the wax and help adhere. So now that the slide is heat fixed, we're going to start staining. So I'm going to put a clip on the slide, and I'm going to start with our fixer. We're going to do about 10 seconds in each stain. And I'm going to rinse. I'm going to allow my slide to air dry. When it's air dried, we'll read the slide under the microscope. So we're going to start looking at our ear smear slide. So we're going to start at low power with no oil, and we're just going to scan our slide just to get it in focus. And I'm going to start on my left ear first. Once I'm in focus and I have my material there on my stage. Then I'm going to move to the next objective, and I'm going to do the same. I shouldn't have to change anything but the fine focus. And now I'm going to move to oil, which is where I'm going to be able to see my yeast and any bacteria if there's any. I don't want to drag any of my objective lenses through that. So I'm going to just drop that, and I'm going to swing my oil lens all the way over. And same thing, I don't need to do any changes except for my fine focus. And now I'm going to scan, and the things that I'm looking for, yeast, bacteria, white blood cells, epithelial cells, red blood cells, nuclear streaming. This slide has a little bit of yeast in here. Not a lot, but enough that I'm going to bring it to the doctor's attention on the left ear. And I'm going to just do a full scan of this side. And then I'm going to do the same thing on the right ear. Get some lens paper. Clean that off. Okay. So I'm going to do the same thing on the right ear. I'd say there was one yeast per high power field at most. Maybe occasional, because there wasn't one in every field. So it may not be enough that he's going to want to treat the ear. I also don't know if that dog was on medication yet or not, or if this is a recurring thing or a recheck problem. So we're going to find that out as well. Alright, so this side is in focus, as well as this side. Okay. So we're going to move back around, put a drop of oil on our slide. We're going to focus, and then we're going to start to scan. The right side, right off the bat, I can tell you has more yeast. So there's about 2 to 3 per high power fields already. So it's significant enough that he's probably going to want to do something with the ears on this side. So I'm going to continue scanning and counting. Okay, so this is Orion, and we are also going to get on him a fungal culture. This is our medium here, which we're going to use. And I'm going to pluck a few hairs from the edge of his lesion here on his head. I'm just going to loosen the top, but I'm not going to leave it open until I'm ready to put the hairs in. I'm sorry, buddy. Pluck the hairs. Stick them right into the gel. Go back and get a few more from another area of the lesion. So what we're going to do is this culture has to be red in 96 hours. We're going to come in and we're going to label it and check it every time we come in the morning. So every 24 hours we're going to check it, and then we will read out the results for a final read in 96 hours. And that's our fungal culture. Good boy, Orion. It's okay. I have my fungal culture here in the lab, and it's going to stay here for the 96 hours or until we see our first sign of growth or color change. It is labeled with the patient's name and the date that it was taken. It's going to stay at room temperature with the cap slightly loose but not completely tightened onto the container. And we're going to read it every day. And if at the first sign of color change or the first sign of growth, we're going to do a wet prep with some cellophane tape and read that out under a microscope. The reason we do that is even contaminant growth can change the color of the medium, so we want to make sure that we are giving it an opportunity to make sure it's not just contaminant growth and not assuming that we're getting a positive reading. What we're going to do is we're going to check our fungal culture. We did get some growth and we also got some color change, so we're going to see if that's contaminant growth or if that is indeed a positive result. So what we're going to do is we're going to start by taking a microscope slide, and we're going to place a little bit of lactophenol blue stain, just a tiny little drop, on the slide. Then we're going to get a piece of tape. It has to be clear tape, it cannot be frosted. We're going to take this off of our feeder here. It's going to be a little tricky because we use the jars for our medium instead of the plates. So the plates are a lot easier to do this with. I'm going to pinch it, and then I'm going to feed my tape in. So the tape is going to act as our cover slip. We're going to put this over top of the stain. And we're going to put this on the stage of the microscope. We're going to look at it under low power on most circumstances. The phenols can damage the lenses, so we don't want to come in contact with the microscope parts. So we're going to make sure we don't do that. And we're just going to view it, and we want to see if we can determine an ID on whatever we got out of our culture here. Okay, so I just double checked and went through another resource to confirm, but it is non-pathogenic contaminant mold growth on this slide, so it is not of a concern, not anything to treat. So we are going to continue with our treatment as it is a hot spot, and it is not a growth that we would worry about on this. So the growth in our fungal culture is contaminant growth. Thank you. So this is Orion. and we are going to do a skin scraping on him today. He has a crusty lesion on the back of his neck. So I'm going to start by taking a microscope slide and putting a drop of mineral oil on it, right in the center. And I'm going to take my number 10 blade, and I'm going to just get the edge of that right in the mineral oil. I'm going to take the lesion and I'm going to squeeze it a little bit so that any potential mites come to the surface. And then I'm going to start to scrape. And my goal is to scrape until I get some capillary blood. I'm only going to scrape in one direction. I know, I'm sorry, Orion. And I'm going to create a little raspberry. Oh, no. I know, oh boy. I know, almost done. Alright. Almost done. Alright, got a little bit of blood there. So I'm going to take what I got from the scrape. I'm going to put this on my slide. And I'm going to take my cover slip, put this on top. We're going to look at this under the microscope. All right. I'm going to start by looking at my slide at the lowest power. And I already have my cover slip on top of it. We did that earlier. I don't need any oil on, so I'm just going to start looking. There's no stain on this slide. So I'm just going to start scanning my slide to see if I see anything on here. A good slide, you should at minimum see a little bit of hair, although most of my area was a hairless area. But I should see a little bit of hair fragment, skin cells of course, some blood cells, and I see all of that on here. And then of course if you have a positive skin scraping, you're going to see mites of some sort on here. The scrape that I did was a fairly deep scrape, which is why the mites that I'm expecting to see, if I see anything, are going to be primarily Demodex or Sarcoptic. This skin scraping is coming up negative, which is good news for our dog.
Examined is the body of an adult squirrel. It was in the hands of a wildlife rehabber for 7 to 9 days after being attacked by a feral cat. In that time, it was treated with appropriate supportive care. It was never neurologically appropriate, and after about 8 days, euthanasia was elected. The squirrel is in core body condition with epaxial muscle wasting. There are no obvious wounds or defects in the skin. There's bruising along the left side of the thoracic body wall, presumably where euthanasia solution was given directly intracardiac. There's some fecal material adhered to the skin of the left hind leg, and again on the perineum. No other external wounds or lesions are noted. The next stage of the necropsy will involve opening up both the thoracic and abdominal cavity. lobes. One.
All the liver goes in one.
We'll put samples of 2 liver lobes in the same biopsy jar. That's 2.
I'm going to make sure to label the jar as liver so I don't confuse my samples.
Next, I'm going to take samples of the kidney.
We're recording.
You can take part of a kidney, or in the case of a small animal like this, we can take the entire body of the left kidney. We'll proceed on to the stomach and then the different portions of the gastrointestinal tract.
So we just finished our necropsy. We got all of our samples from the abdominal and thoracic organs that we needed for the necropsy. One thing I did want to mention is that even though the animal is deceased and we're not in a sterile procedure, it is important that you wear your protective jacket or outerwear of some sort, like my jacket. You wear your gloves and you wear your mask like we have. Rabies suspect handling should be done by only vaccinated personnel. That goes for alive patients as well as deceased patients. If you're handling a decapitation, you should be in protective equipment, so that means that you should be wearing gloves. You should have protective outerwear on, so you should either have an apron on or you should have a protective gown on, so like a surgical or a isolation gown on of some sort to protect your clothing. You should have a mask and eyewear on as well. This is to protect against blood spatter, specifically for rabies-borne viral disease, but also just for good overall hygiene. You want to wash your hands when you're done, completely and thoroughly. And as far as handling the specimen afterwards, when we send the body out, if it's being picked up by the health department, we double bag. So one bag tied up tightly and then put inside of another impermeable bag tied up tightly. It's kept in the fridge until the health department picks up, and then they bring their own cooler and ice bags or ice packs to keep it at the proper temperature when they pick up. We hold the rest of the body double bagged in the freezer until it's determined if it's a positive or negative for rabies, and then it's determined if it needs to be cremated afterwards as far as what's to be done. If it's getting shipped up to Cornell or somewhere else for rabies testing, as far as if it's an owned animal, then it follows the same protocol as far as 2 impermeable barriers. But then you also need to have a cooler with ice and absorbent material, or ice packs with absorbent materials. As far as that, then afterwards you need a box to go around it, and then you need the appropriate labeling since it is a specimen inside the box. But the most important thing to remember is that you do not have anyone handle the specimens that is not rabies vaccinated. And that is it for rabies suspect handling. We're going to get a vaginal cytology today. Dr. Popolo is going to actually take the cytology, and what we're going to do is we're going to start by cleaning the vulvar area with some sterile saline and some sterile gauze.
And I'm going to use my left hand since I'm going to be taking the sample with my right hand, contaminating the swab.
Girl. When she takes her swab, she's going to go in at a slightly upward angle. Stay curl. And she's going to collect her cells. And she's going to roll them on the slide. She's not going to smear them because it damages the cells. That's a good girl. Good girl. And we're gonna let those dry and then we'll stain them after they're dry. Good girl. Okay, so now we are going to stain our canine vaginal cytology slide. So we let it dry, and we're going to stain it in our 3 different stains, starting with the fixer. We're going to let them sit each. I'm going to rinse the back of the slide. A gentle stream of water. I don't want it to be full blast. Now I'm going to let it air dry. Okay, so now we're going to look at our slide. I have it on our stage. We're going to start looking at our low power to focus it. This is 4x here. So I'm going to look at it between the 10 and the 40x objective lens. So right off the bat, I can tell you that we have a lot of neutrophils, so a lot of white blood cells. And on this first view that I have, we have a couple parabasal cells, but we have a good number of intermediate. So the things that you would see when you're in anestrus are going to be intermediate cells mixed in with parabasal cells. You may or may not have white blood cells like neutrophils. You may or may not have red blood cells. If you are in proestrus, again, you may have a mix of parabasal and intermediate cells. You will definitely have some superficial epithelial cells and some red blood cells. You will have bacteria as well. Males will be attracted to the female at this point, but the female will not be receptive, so you won't be able to be successfully breeding at that point. So breeding is not recommended at this stage. The next stage would be actual estrus, and at that point the female is receptive and the dog can get pregnant. So that's actual ovulation at that point. And the cells are almost all nuclear at that point. So the cells are superficial cells, they're keratinized, and they look much different. So the parabasal and the intermediate cells are all gone at that point. And then the final stage is diestrus, which is the reappearance of the intermediate and the parabasal cells. And the dog is no longer receptive at that point. So after scanning this slide, it does appear that the dog is either in anestrus or in very early proestrus due to the lack of red blood cells. And that looks like the final outcome. This is my cross-match agglutination test. So I have my 2 samples from our canine patients. I have a donor and a recipient patient, and I have serum separator and EDTA tubes, both of which have been spun down. I'm going to start by taking my EDTA tubes, and I'm going to remove the plasma off of the tube, and I'm going to discard that so that I just have my packed cells down at the Okay. Right, the next thing I'm going to do is I'm going to take 2 cells from my donor, or 2 drops of my red blood cell packed cells. I'm going to put it in a tube labeled donor red blood cells. I'm just going to do 2 drops. One, 2. And I'm going to do the same thing for the recipient one. next thing I'm going to do is I'm going to take off my serum for my recipient and my donor. Okay, so the next step we're going to do is we're going to take the red blood cells that we pulled off, the 2 drops, and we're going to fill the tube up with some 0.9% saline, and then we're going to centrifuge for a minute at about 3,400 RPMs to start our washing. And I'm going to do the same thing to both the recipient and the donor. I have just returned. If you can see, I have both of my recipient and my donor red blood cells have been washed for the first time, so you can see they have been centrifuged down to the bottom. So I'm going to decant off the saline mixture that's in there, and then I'm going to repeat the wash cycle 2 more times until the saline mixture is completely clear. Okay, so my final wash is done. So my donor and my recipient red blood cell have been washed thoroughly, and the okay. So now what we're going to do is we're going to make a 2% solution for the red blood cells. So we're going to take 0.98 cc's or mLs of saline, of 0.9% saline, and we're going to put that into a new clean test tube. So I have that here. I'm going to start with my donor, and then we're going to draw up 0.02 mLs of our washed red blood cells for our donor. If I can reach it with this, I might have to take off my needle. Okay. The 0.02 is a very small amount. I don't know if you can see that on there. Okay, I'm going to drop that right in. All right. Then I'm going to do the same thing. Let's start with the saline for the recipient, and I have 2% red blood cell on here. The first thing we're going to do is we're going to make our major cross match, which is the tube that's labeled here. So we're going to take 2 drops of the recipient serum, which I have labeled here, and we're going to take 2 drops of the donor red blood cell solution, or suspension rather, which I have here, and we're going to put them in the same vial, which I have labeled as our major cross match. 1, 2. Then I have 1, 2. Okay. So this is our major cross match, okay? So they are mixed up gently, and that is it. The next thing that we're going to do is we're going to make our minor cross match, which is labeled here, and that is made by taking the donor serum and the recipient red blood cell suspension. Same method though. We're going to take 2 drops of each and put them in the same test tube. Gently mix them. Once all of these are mixed, we're going to incubate and let them sit for 30 minutes, and then we're going to centrifuge for a minute at the same 3400 RPM. Once that's done, then we're going to check for agglutination. Okay. Okay. So that is in there. All right, and then finally what we're going to do is we're going to make our controls, because we need our controls to make sure that our test is running properly and there's not any agglutination or any issues before we run the cross match. So I'm going to make a recipient and a donor control. So that's made by just adding their 2 samples back together. So I'm going to start by my 2 donors. So I'm going to do donor serum, 2 drops of that into the donor control. So 1, 2. And then donor red blood cells. 1, 2. That is my donor control. And then recipient control. Same thing. I'm going to take my recipient serum. 1, 2. And my recipient red blood cells. 1, 2. So I'm going to let these sit, and then I'm going to check back in a half an hour. Okay, so I have my 4 samples. They came out of the centrifuge. If you can see them, there was a little bit of color change when they came out. I know not all hemolysis is bad, but there was a little bit of color change that I noticed. And when I went ahead and I mixed the tubes up a little bit, I gave them some gentle tapping. I did not notice any visible agglutination macroscopically, but I have made some slides. So right now I'm looking at my major cross match, and I have not seen any, on this one, I have not seen any agglutination. The cells are all nicely laid out, spaced apart, moving, or, you know, floating freely, so to speak. There's no rouleau or agglutination in here. So this one is fine. So I'm going to look at my minor cross match. When I look at these, I have my condenser turned way down so that I can see everything on the slide. Since there's no stain. So this one, however, does have clumps of red blood cells. So I would not put these as candidates for cross-matching, because I do see agglutination on this slide. So I would not put these dogs as candidates. I would find another donor for this dog.